I thought it would be a really good idea to talk about healthcare. Yes, probably the number one concern people have, besides obviously running out of money, is when you early retire, what are you going to do about healthcare? So that's what we're going to talk about today. Hey everybody, it's David from David in Progress. And yes, I'm alive. I recently went through quintuple heart bypass surgery. So basically 5 bypasses of my heart. And if you watch my last video, I recorded it from the hospital. I was a little drugged out, so my apologies for that. But I do want to take a moment and thank everyone that left a comment, that sent me messages, and for your great kindness and concern while I was in the hospital. I very much appreciate you. And it's one reason why I love this channel so much. It's the community of people with a common goal, that early retirement, reaching financial independence, living your best life, and we're all doing it together. And given what I've gone through recently, I'm going to go over what I'm doing this year for healthcare and options that I have, or you would also have too, for healthcare starting next year. So I hope you'll join me. Let's talk about it. So before I get into some details, I'll just tell you a little bit and make it very quick of what happened. In May, I went to my normal annual appointment with my doctor, and as he was listening to my heart, he said it sounded a little bit off, and he put me on an EKG. And the result of that sent me to a cardiologist, and after several tests, it ended up that I have coronary heart disease. I had no idea. The week before my doctor's appointment, I'd gone on a 3-hour bike ride. No problem. A couple of weeks before that, we'd been to Utah and done a bunch of hiking. No idea. So let me encourage you that if you have heart disease in your family, or if you have any concern, get that $50 heart scan that you hear on the radio and just see. The last thing you want when you go into early retirement is a major health issue. So I was laid off in December, and then for this year, 2024, I decided to go with Cobra for our medical. Now, Cobra is something that you have when you leave an employer. It can last from 18 to 36 months. Most people, it's 18 months, and that's what I did. And Cobra is expensive because you are paying for basically all of your medical. I knew in 2024 that we would not qualify for any subsidies within the ACA, which is what we're going to be talking about shortly, due to my income. My income was going to be higher in 2024 because I received a severance all the way through the end of May. And I did a Rule of 55 withdrawal. You can watch my video on Rule of 55 in order to fill some of our buckets to be ready for early retirement. My current expense for Cobra is $1,246 a month. Whew, that's a big number, isn't it? And my deductible is $8,500. So for this year, my total medical expense is going to be $12,460 for my monthly fee. And then obviously I'm going to reach that full deductible $8,500. So that nets out to $20,960. However, in comparison to my total medical bill for what's going on now, that is a bargain. I'm at over $202,000, and I've only received a couple of the big bills. So that amount, that $20,960, very well worth it. And I'm very thankful for Cobra. Now, that expense is not sustainable. It would take away too much from our monthly budget. So for next year, there are several options for healthcare. Here's what I could do. I could go back to work. Maybe go back to work full-time. Just forget this whole early retirement thing and throw in the white flag, and we'll just go ahead and get back to a full-time job. I could potentially get a part-time job. There are many companies and places out there, from what I understand, that if you work part-time, you do have a little bit of a benefit of health insurance. I could continue Cobra. Yeah, I could have it for up to 18 months, so I could go another 6 months into 2025 and still have the Cobra coverage. I could sign up for the ACA, the Affordable Care Act, in November. You know, there's other health plans. I've looked up like Medishare. You know, these are generally like a faith-based type group insurance, and they're very confusing to me, but I have checked into those as well. And of course, we could just move to Costa Rica or something. One of these countries that has universal health care and allows expats to enroll in their health plan after they've been there for a while. So what are we going to do? I have decided at this time to go with the ACA. Open enrollment for that comes up in November, and I will do the open enrollment and begin the ACA starting in January. The key to using the ACA for us is that we have a zero debt and very low expenses. I encourage you to watch my video where I talked about how we became debt-free and when that happened. But being out of debt is just one element to it. We also have very low expenses. I live in a small house. I'm in a state with relatively low taxes. As a result, I have low minimum expenses relatively. And I say minimum because there's other things that are thrown in there. I have I want to live a rich life in our early retirement. So I have a really great travel budget. And I have a budget for going out to eat. And I have a budget for a lot of different things. But even with that, our overall expenses are really pretty low. Now, I'm going to take a moment here and go through some screenshots of the ACA. So if you've never done this, I highly encourage you that what you want to do in planning your future healthcare is go into Healthcare.gov and play with it a little bit. Keep in mind, there's always talk out there about the ACA going away. You know, we're in a really strange political climate. I am prepared mentally that this could change dramatically or maybe even go away completely, but we're not going to live in fear. And we're not going to not do things because of the unknown, because we are living our best life now, right? The first thing you'll see when you go to Healthcare.gov is a page where you log in and you put in your zip code. And one reason this is important is that the plans, the subsidy amount varies greatly by state. So you'll want to put in your zip code and look at the plans available within your residence. The first thing it's going to do a couple of pages in is ask for some information. You're going to put in my case, we're married filing jointly, so my wife will be on the plan with me. If you're single, you'll not include that. You can see you put in your age, and then there are some health conditions. Then here's the important part that you want to play with is your household income. And what's really important to understand when it comes to the Healthcare.gov is that the income considered for your subsidy is your modified adjusted gross income. So it's basically your total income. I was confused on that the first time several years ago. I thought it might be after the standard deduction. This is before your deduction is taken out. So that is very critical for you when you're targeting how much income you have for the sake of a subsidy, that you're looking at your adjusted gross income, not your income after any deduction. So I typed in this particular example that I'm going to show you is a married couple filing jointly here in Oklahoma where I live with a $65,000 adjusted gross income. So let's look at this. Oh, wow, look at this first one. This is a bronze plan. So there's bronze, silver, and gold. Bronze is the plan where, if you look at this is a married couple filing jointly, $65,000. This is the very first plan that came up. Look at the premium, zero cost. That sounds affordable, doesn't it? What you got to consider is that this is basically a plan for catastrophic care. So zero premium. Look over there, $15,000 deductible, and the out-of-pocket maximum at the family is $18,800. Further down, you want to look at what you pay. Primary care, specialist care, urgent care, emergency room, outpatient, and you can continue on. So this, at $65,000 AGI, you could potentially pay zero. If you're a very healthy person, you're not worried about quintuple heart bypass surgery popping up, or let's say you have a significant amount of medical savings and you're okay with that $18,800 out-of-pocket maximum, then you could just go with a bronze plan. In a particular case, someone living where I live at $65,000 and pay absolutely nothing. In my particular case, and for our illustrative purposes, I'm with United Healthcare. So what I did is I've gone in and filtered where I'm only looking at United Healthcare plans as an example. And let's look at a bronze United Healthcare plan example. This one, the monthly premium is $217.91. You can see on this one, the deductible is less at $13,400 and the out-of-pocket maximum is $16,100. Just like any medical plan, the more you're paying in your premium, the less you're going to pay for deductibles, and it's likely that your out-of-pocket maximum may be less as well. Real important to look at that you pay line and go through each one of them and see what your co-pays will be, your cost for drugs, and also in my particular case, because I will be seeing specialists for quite a while, I'm looking at the cost for specialist care. Now, someone in my situation probably not going to go with a bronze plan, so let's look at a silver plan. This is also with United Healthcare. Here's the difference. The premium is much higher, $749. Now, keep in mind I'm paying over $1,200 now, so that is a significant savings compared to what I'm paying now. The deductible is $6,500, and the out-of-pocket maximum family total is $18,900. The you pay section, you can see there's a big difference there in how much you pay for primary care, specialist care, and then you can go on down. So that's a pretty good plan. Another one, let's go gold. So this is the first plan that came up in gold. This is with United Healthcare again. You can see the premium is higher, $782.91. You can see the deductible is now $4,000 and the out-of-pocket maximum is $17,000. Now, what is crazy, there are over 96 different plans to choose from between the bronze, silver, and gold. That's a lot of different plans. It is really confusing. Looking at the the you pay options, the deductibles, the out-of-pocket, very, very confusing. In my particular case, I'm using an organization called Via Benefits to help me with my choice when I get to November. It was something that my former employer provided through T-Mobile. And as I go into the Via Benefits and do the searches, it cuts down the plans quite a bit, and hopefully that will help me out. Another thing that is very, very important. Now, I used United Healthcare as my example. I'm on United Healthcare now. All my doctors, everything I'm doing now is through United Healthcare. There is a section within each one of these plans where you can put in your doctors and your medications. I was quite surprised as I looked at it that many of the United Healthcare plans, the doctors I am currently going to, do not accept that insurance. I've heard many horror stories of people that have moved to Marketplace Insurance, even though they may have kept the exact same provider, and then suddenly find they can't go anywhere that will take the insurance. So it's very, very important as you're making your choices that you want to be sure and fill out every section. Make sure if you want to stick with the same doctors and hospitals you're going to now, that you type those in and you make absolutely sure that the plan that you're choosing is accepted to where you're currently going. If that is a big deal to you, obviously it would be a big deal to me. So research required. So as you can see, healthcare is very important. If you are 10, 12 years out from early retirement, you have some big advantages. I have a great video, I think, on the health savings accounts and the importance of them. If I could turn the time clock back about 10 years, I would be maxing out that HSA year after year after year, so that when I am in early retirement, I have access to a giant pile of health savings account money. I highly encourage you to watch that video. You can also make sure that you have a large cash emergency fund in case something like this would happen. I have a larger amount of money in cash that most people might because of such a situation. The key is to plan and think. Be ready for the what ifs. You just don't know what life is going to throw at you. However, as I said before, don't let fear hold you back. Planning can overcome fear. If you have a good plan, you'll be ready when the punches start coming. And maybe the plan that you thought is not the plan that you go with, but you'll be prepared for whatever comes at you. Thank you again for watching. I want to hear from you. What is your plan for healthcare in early retirement? Are you going with the ACA? Are you going to move to Costa Rica? What is your plan? And once again, let me just thank you for all the encouragement during this health situation. You know, one of the great things about channels like mine is that you get to learn from us. Those of us that are out there talking on YouTube about our early retirement experience, that are actually living that life. You're going to learn from our mistakes. You're going to learn from the things that we do great. The purpose of these channels is to help you be your best and have your best opportunity when you get to where I am now and where the others who are doing this are now. So thank you so much for watching. Thank you for the thumbs up. Thank you for the comments. And thank you for being part of my community.